when one of the things that we worry about a lot is appropriations to keep the government running is the plan had been that they would do, well, the House wanted to get all 12 bills teed up into the Senate by August. That's not going to happen. The bills that are coming out of appropriations in the House would not pass the Democratic Senate. And everybody knows that. And in fact, before the labor HHS appropriations bill was marked up, I was in a couple of Democratic offices with a client who really cares about a couple of things in the appropriations bill. And I was told, please don't come back and yell at us when you're told these programs are zeroed out, because these aren't the real appropriations bills. So the scenario that's happening, that appears to be developing, is we kind of expected they'd have to do a continuing resolution through the election. And that seems to be where everybody's head is now. We will do a continuing resolution to get us through the election. When they come back, they may have to do another continuing resolution to get us to Christmas. They may also decide just to do a continuing resolution through to the next Congress and let Congress deal with appropriations. That was not the original plan. And no one's really happy about it, but I'll be very honest with you, and I'm not trying to be political. The uncertainty about Biden, the Trump assassination attempt, and some other uncomfortableness with both parties internally have led people to wonder, if there's a Republican sweep, is it worth trying to do appropriations bills while you still have a Democratic Senate that can block things? Do you just wait? If there's not a Republican sweep, why would Democrats want to go ahead and beat their heads against a wall to try to get something done while you still have the House controlled by the Republicans? So the politics may be better for everybody if they just do do the resolution and kick it into the next Congress. So that having been said, there was a labor HHS bill marked up in the appropriations bill committee. It is 7% below the enacted levels of calendar year 2024. It's 14 billion below the president's request. It zeroed out a number of programs. It zeroed out an entire agency called ARC that does a lot of research, and it completely reorganized NIH, which was a surprise to many, particularly some at the Energy and Commerce Committee, because the Energy and Commerce Committee was already putting feelers out about how to reorganize NIH, but they went ahead and did it in the appropriations bill. The report accompanying the House Appropriators Bill also lays out the Republican views, since they're in the majority, on a number of healthcare issues, one being what are known as margin rights. The NIH has an ability to lower drug prices under certain circumstances through what is known as margin rights, and they don't like the proposal that Biden has put out on that. It urges some tweaks to the Medicare drug price negotiation timeline on what are known as small molecule drugs that target rare genetic-based diseases. They want 340B reform. Everybody wants 340B reform. That's not just a Republican issue. And they want to tweak the CMS proposal to change the Medicaid drug rebate program. And some members actually don't want that rule finalized at all. So that at least gave us sort of an idea of some of the places that Republicans want to work on, and perhaps in lame duck. There are a number of regs that we are expecting to come out, and I want to highlight a couple, well, more than a couple, but some of the more significant ones. The Drug Enforcement Administration is probably going to get its telehealth prescribing rule out in September. This is really an important regulation. They have changed the title of it to Special Registrations for Telemedicine and Limited State Telemedicine Registration. It should be issued 3 months before the current pandemic era extension that allowed providers to prescribe controlled substances via telehealth. The proposed rule had required an in-person visit, and a number of stakeholders really said how bad that was to require, particularly in rural areas. And because of the title change, people are reading a lot into it. And one of the things that people are reading into it is that perhaps it will simply be a regulation that requires you to register once, require telehealth providers to register once. And if you're serving a large geographic area, you're serving a large geographic area. So a lot of people are waiting for that. The DEA says they got more comments on that particular proposed regulation than they have on any other regulation that they have done. Another one that's really important for healthcare providers is the new interoperability regulation that we believe will be out in September or perhaps October. It builds on a previous reg related to artificial intelligence and interoperability. And it also would contain some new provisions meant to prevent information blocking. There's a proposed rule to update emergency preparedness mandates for providers and suppliers participating in Medicare and Medicaid. They are hoping to get that out by October. There's a data protection reg that follows a Biden administration executive order cracking down on foreign entities accessing Americans' data, including genetic information. There is a Department of Justice reg that we are hoping to see soon that relates to disabilities and diagnostics. It would try to ensure access to medical diagnostic equipment like x-ray machines and exam tables for people with disabilities. That has already been at OMB for 2 months to be reviewed. And there is one reg that a number of people have been waiting for, and it is really not clear when it will be finalized now. And that's a regulation that would require insurers to treat mental health care on the same terms as other kinds of care. It hasn't even gotten to OMB yet. There was a real push to get it there this summer, in the beginning of the summer, and it just has not moved out of the agency. Couple of other things I want to just highlight because you're going to be hearing a lot more about this. There's a Supreme Court case that overturned the Chevron doctrine. I'm not a lawyer, so I'll just put this in very simple terms. That doctrine essentially means that in legal cases now, judges and others cannot look at what the interpretation of the agency was when they wrote the regulations. It really puts the interpretation of the regs back on what was congressional intent. This means that Congress will have to draft and pass bills that are far more specific about how to implement proposals. But it is calling into question a number of things that are already out there. And Senator Bill Cassidy of Louisiana, who's the ranking member on the Senate Health, Education, and Labor and Pensions Committee, the HELP Committee. He's also sits on Senate Finance. He's also an MD. He's really smart, and he's one of the Republican members a lot of people like to work with because he is so smart. He's already sending letters to HHS asking about how they're interpreting several things. One is the No Surprises Act, and the Bayh-Dole Act, which is where the March-in rights are. And he is asking whether HHS would be undertaking an action-by-action review of all of its policies to find areas where it might need to make changes to comply with the new Supreme Court ruling. Over in the House, a number of members have decided that this has given them more authority to ask questions and hold hearings asking about administration policies. The Energy and Commerce Subcommittee Chair for the Health Subcommittee, Brett Guthrie, said in a statement that he believes his subcommittee now has more power to investigate and ask questions. And one of the issues that they're all starting to ask questions about is about the ACA premium taxes. And I need to say a couple of things about that. There was a report put out by a think tank called Paragon Institute that said there was fraud in the ACA premium tax credits, and that as many as 5 million people had received them when they had received subsidies, and they shouldn't have. I know others who disagree with this. Maybe there's some fraud, but not 5 million. But there will probably be hearings eventually on this. The House Committee Chair, Kathy McMorris Rogers, the Ways and Means Chair, Jason Smith, and the Judiciary Committee Chair, Jim Jordan, have all asked HHSI, Office of Inspector General, and the General Accountability Office to investigate and look at that and come back and tell them whether Paragon is correct or not. And whether these mistakes were just accidents or true fraud. Neither the GAO or HHS has said they're going to do anything yet. I will also say that some of these, the ACA tax credit will also expire next year. There was discussion in the spring about trying to figure out how to get an extension tacked on to something passing. While Democrats felt they had some leverage in the Senate, that isn't going to happen. And it will be a big fight next year.
Stephanie, just sorry, one question. If you could please just give a pause for some interpretation catch up.
Sure.
And maybe we could have a note in the chat when we're caught up, and just to give it a little more time.
For some reason, I can't see the chat. Not sure why.
It's okay. Just give it a little bit.
No, just tell me when.
I think we're good. Okay. All right. If please go ahead, Stephanie. Maybe
Sure.
just pick your next pause. And that might
Sure. I'm almost done. The last thing I wanted to say is that there are a number of issues that need to get to the finish line, or a number of members want to get to the finish line. PBM reform is high on everyone's list. Healthcare cost transparency, however anybody wants to interpret that, is high on the list. And also high on the list is site neutral reform in Medicare. That's very controversial. They're all controversial, but that's very controversial. The hospitals have been fighting it like crazy. And Finance Committee hasn't acted on it yet, but the House committees of jurisdiction have. So those are the three I think we're likely to see action on in lame duck. There are a lot more healthcare issues people can address, so I wouldn't be surprised if more gets in there, but we'll have to take a look at that when we get through the elections. And that's all I got for you.
Thank you. Do folks have any additional questions? Oh, sorry, please.
No worries. Hi, this is Paul. Just a question on the subsidy fight that you mentioned. Is that the subsidy expansion itself, the most recent ARPA expansion?
Yes.
Or, okay.
Yes.
Like the digging broader than that is not probably in play?
I would not. I'm a pessimist. I don't think broadening will happen, and I think getting it extended will be horrendously difficult.
Okay. But I guess I was thinking, sorry, a broadening of the pulling it back.
You meant further erosion.
Further erosion.
Oh, further eroded? Yeah, I think it's going to be an uphill fight to keep it the way it is.
Okay.
And I hate telling you all that. I really do.
Thanks for the question. Anyone else in the room or online? Okay, I don't see any hands. I don't know if I would, but I think you all would. So, okay, I think we're good. Thank you very much, Stephanie, for your time and for the update. Lots of things in the works here, lots of uncertainty.
Thank you. Take care.
Take care. Okay, I think next is Bridge. And I was looking at our minutes from last time. I know this group was particularly interested in mitigation and some information about membership. And I am so sad there's not a bridge on this slide. I feel like, I mean, I know that the reference to bridge is waning, but I really relied on the regular bridge art. So I'm
I will
sad.
include the logo next time.
I got it. Take it
Just
away,
obvious.
folks, please.
Good morning, y'all. Yes, I'm super sorry that there's no longer extensive bridge art on our presentations. It really has been traumatic for me as well to go away from that.
Got it. Good to know it's shared.
Yeah, make sure that the minutes capture that. So the big news, really the big update on the program side is that OHP Bridge was launched on July 1st of 2024. And about 23,000 people moved into OHP Bridge as of July 1st. There's still about 1,600 people who've remained on the temporary Medicaid expansion that was created to hold folks after redeterminations prior to the creation of the program. Some of these individuals will still move to OHP Bridge. The state is awaiting their responses to requests for information, still determining eligibility. In some cases, folks may still move to Bridge or to another Medicaid program, or if they're not eligible, could have their OHP coverage closed and would get sent to the marketplace. And then about 1,300 folks moved to another Medicaid eligibility category. And then 3 people were closed due to a valid reason, but for the most part, there's not closures as of this transition. This number is a bit smaller than the previous estimates, and really the big reason is the establishment of 2-year continuous eligibility for Medicaid really at the same time. We definitely saw that somewhere in the 20 to 30,000 people sort of looked like they were going to be eligible for Bridge or the temporary Medicaid expansion because of their income, but because of the creation of continuous eligibility that had been able to stay in Medicaid. I think it shows that the income fluctuations were happening maybe faster than we thought after redetermination. But so we do think that eventually there will still be movement into Bridge from some of these folks, but again, that 2-year continuous eligibility will potentially keep more people on Medicaid than we initially anticipated. The other big update from a program standpoint is the next slide, and we wanted to just give an overview, a highlight that OHA is going to be creating the Oregon Bridge, OHP Bridge Advisory Committee, or OBAC, and it really is sort of built on something like the Health Insurance Marketplace Advisory Committee or the Medicaid Advisory Committee, a forum to provide recommendations for the program and guide the management of the trust fund, the funding that we get from the federal government, to discuss member outreach and communication, provide a venue for reporting on the program and on any federal negotiations and revisions to the program or to the benefit package. Recruitment will begin very soon, and we're proposing a 13-member committee that would include both Bridge members, representatives from providers and healthcare organizations such as CCOs and others, assisters and health equity experts, as well as OHA and ODHS representatives. So if there are folks in your sphere that you think would be good for this, definitely let us know. And then once we have the official announcement and are accepting applications, we'll get that out as well through other venues. But that's the big update from a program standpoint, and I think I'm going to turn it next to Sean to talk a little bit about communications.
Hello. My name is Sean McNulty.
Sorry, 1 second.
We have a question?
Yeah, I think, Tim, we have some questions. Do you want those now, or do you want sort of all questions at the end? Maybe stepwise makes sense.
I'm happy with however. I'll be
Let's do
here.
it.
So
Yeah. Could you just, this is Stacy, by the way. Could you expand on what the original projections were? Because I just don't know, I don't remember what they were and how it fell short. And then how that's impacting your future projections.
Yeah, certainly. So initially, the estimates for the number of people who would move directly from Medicaid to the new program were 45 to 65,000, and so in a lot of scenarios we went with the midpoint of 55,000, and that was the sort of like the initial movement from OHP plus. We also have expected about 45,000 people to come onto the program, either from who are in marketplace coverage now or who don't have health insurance coverage at all right now. And we don't have any reason to believe, we're not changing those estimates. And frankly, some of the lower initial movement from OHP Bridge may also be because we've extended redetermination timeline for a group of about 100,000 people. That's a group that will be less likely to go into Bridge than the overall population was at the beginning, but still there could be some more movement. And so I think to answer the how does it change our forecast, I think we're still looking at that. We're still processing the data from that initial move and looking at the potential movement from the rest of the redeterminations period, and also awaiting to see how ongoing movement from OHP plus happens.
Thank you.
It doesn't threaten the viability of the program at this point. There's no data that suggests now that there's any problems.
Thank you.
Any other questions?
I think not yet. Please go for it. We'll see.
Sounds good. Well, hi, my name is Sean McAnulty. I'm OHP's member communications coordinator now, though I used to be a member of this committee as well, so I'm glad to see everyone. I got invited here to talk about the OHP Bridge communications plans that are happening in various different efforts, all wrapped into one sort of topic here. So first off, if you're looking for OHP Bridge information, the general best place to find that is our website, which is ohp.oregon.gov/bridge. If you're looking for some OHP Bridge imagery, we do have a nice video that has that, that you can go look at the top of the page there. Also available in Spanish. That's where we'll find all the materials we're referring to today here. In general, though, OHP Bridge is going to feel very similar to OHP to members, and it's going to follow all of the normal OHP processes for communicating to new members. So they use the one system to apply, though healthcare.gov will also refer. They're going to get those standard one system eligibility notices. That'll be their main notification that they got Bridge, for instance. And then from there, the CCO takes the communication for the basic health program members who are only able to get services through CCOs, and they would send them updated member handbook that contains OHP Bridge information. They use the same ID cards as if they're moving from OHP to OHP Bridge and whatnot. So it's going to feel very similar to the member as traditional OHP. If we can go to the next slide. So for transition populations, we had the group that Tim just talked about that moved from OHP, specifically the expanded adult program, which meant they kept their OHP during renewals since the pandemic unwinding. Those folks got 2 letters if they were moving to OHP Bridge BHP. The basic Medicaid members just got 1 letter. We had 1 notice in June that was customized with a lot more information about the upcoming move, and like very specifically to OHP Bridge and the movement there, that services are only delivered through a CCO, that sort of specific information. And then they got a second notice right at the end of June. That was the one system action to actually move them over to OHP Bridge. So there were 2 notices that the members that were new to Bridge received. And then if that newly enrolled them in a CCO or anything, they would then get the CCO member handbooks and additional communication like that from the CCO side. For Marketplace members, members will not automatically transition over to OHP Bridge. There's no broad communication happening right now to them. Whenever they update their application, that would be when the system refers them over to OHP Bridge or to the one system for screening for OHP Bridge. And then if approved or denied, they would get the eligibility notice at that stage and approval coverage letter and CCO welcome packet and whatnot if they get approved for Bridge. We're also heavily planning some additional partner support during the open enrollment season. We've got some webinars and whatnot for partners that will be heavily featuring content about moving between or from marketplace to bridge. We expect a lot of those updates will happen during the open enrollment season naturally. For partners at that time, we really want to emphasize the message of canceling your marketplace plan if you do get approved for OHP bridge. That way you don't end up on the hook for tax credits going forward or anything like that. But given that's a message that's really only a message for people who have already received the OHP bridge determination, that seems to be a very specific one. So it's not going to be the focus of the broad campaign. If we can go to the next slide. So there's a few different efforts happening around all this. Two general themes to split apart at the moment is that we've got one campaign that is very generally health coverage focused, inclusive of marketplace and whatnot, and then we've got other things that are OHP bridge specific materials. Basically, most of the OHP bridge population is going to automatically move over from either OHP or marketplace. So the part we really need to do outreach to was the remaining uninsured group. We've got also within that uninsured group currently, most of the members are either qualified for OHP or marketplace, and a minority would be OHP bridge eligible specifically. So we really wanted to aim at trying to get all those folks covered as best we can, try to reach Oregon's goal of 98% coverage. And then using that framing, we really focused on trying to have a general message, use the newsy bit that OHP Bridge opened free coverage to more people, but focus more on getting people covered through whatever program they're eligible for. We can go to the next slide. That results in our advertising campaign, which is a continuation of the same contract as we did our advertising for the unwinding renewals through the Met Group. That was the Keep Covered campaign. We are updating that to a more outreach-focused message of health coverage. Get it, use it, keep it. Trying to bridge the gap between just getting health coverage to also going and connecting to that appointment and addressing the actual health needs as well. A lot of these ads are going to feature messaging that says more people with higher income now qualify, or something to that effect that we've expanded, trying to get more people to apply using the newsy hook of OHP Bridge, though we also heavily feature the marketplace messaging in here, and it's not really the OHP Bridge specific content that we have in other things we'll get to later. So we've got a mix of digital and physical advertising running through September. You may have already seen some digital ads or ads on buses and whatnot. We have regionally targeted all of these based on estimates from the marketplace of the uninsured, where they are regionally currently, and that's how we allocated most of those resources. We can go to the next slide. We've got some ads examples here on the left with the more people now qualify for free coverage, trying to use the OHP Bridge hook. And then the flyers, the example on the right, where you see more of our messaging breaking out. We've got the enrollment part, the get it. We've got both OHP with now being open to more people and the marketplace prominently mentioned there. This flyer is swappable for community partners. That way they can put in their organization's contact information into the speech blurb area there. So that will be releasing later this month to the partner side. These will basically be our general outreach flyers for 2024. So if you're doing general health coverage outreach, you give this to a patient or have this in the event. Whereas we will also have specific OHP Bridge information in our partner toolkit we'll get to next. Next slide. Another contractor helped us with this toolkit we've got for partners, which is on the OHP Bridge website. This has got background information, key messages, partner resource document, and graphics, things like that to help OHP assisters, insurance agents, help people sign up for the new program and have the information they need to support in that. So that's distinct from the non-OHP Bridge specific outreach materials we got coming up. We also rolled out the partner training for insurance agents and assisters on May 15th, so that's available for anyone who needs that. And we spun up an office hours series, which is a continuation of our pandemic unwinding one, where we're answering partner questions every month, having the SMEs or the subject matter experts attend to be able to give that venue where people can ask their complicated questions and reporting back questions we get during the month. So we'll keep that going. That's going to be one of the major venues for helping support those marketplace transition, pushing that message out to partners in the fall. And we'll continue to do that through our other channels like CPOP, the Community Partner Outreach Program, regional meetings, our state channels and whatnot as well. Next slide. And I think I'm handing off to Katie Button, but before then, I wanted to take a moment for any questions.
Charlie.
Yeah, you can go first.
Good morning, Sean. Is that OHP bridge? I'm looking on the website. You have an age limit, right? Up to age 65.
Yes.
So what about the other people who immigrant who pass 65 but not qualify for Medicare? What do? They fall
wouldn't-
back into people who immigrant non-qualify for Medicare. So what do?
They would
But
not qualify for OHP bridge. They would continue going through the marketplace as they do currently.
Got you. All right, thank you.
You may have said this, but I'm wondering what communications you're planning for people who are moving from the marketplace to OHP bridge ahead of time, just so like when they go to renew, they aren't surprised that they're changing, their coverage is changing pretty substantially, better, but not what they were probably expecting or what they've seen in recent years. Is there any specific communications to those people kind of leading into the phase when they would be renewing their coverage?
We'll be using our state channels like social media and whatnot to mention that this is upcoming and that many people will move during that, but we are not going to be able to specifically identify who based on in advance at least until they update their application and it gets referred over to our screening process to find that. So in many cases, their first notification would be the eligibility letter from us.
So Charlie, this is tricky for everybody on the phone. So it's also, again, one of those limitations because we are on healthcare.gov. We have limited access to data and to do very proactive outreach that way.
Well, looking forward to the next topic of conversation.
I do want to add that when someone goes through, it'll be very similar to the experience now. So if someone goes through, well, I should say before July 1st, if someone goes through and they're potentially OHP eligible, they would get moved over. So they'll get it in their eligibility notice. And that, yeah, so they will get something prior to the OHP notice. I did want to add that too.
And Amy Coven is our marketplace communications.
Yes, sorry, I did not introduce myself. Thank you.
So I know that I had somebody yesterday that they're losing their group coverage and looking to go to marketplace, making 30,000, and the system said OHP. So does that mean they're going to be forced to apply for OHP? And then how long is that going to take? Because he has a surgery that's coming up in August. And so he wanted coverage for sure August 1st with the providers or with an insurance coverage that would cover his providers. So what do we do with something like that where we don't know how long it's going to take for them to even apply, get a response, and then determine if they should go on to marketplace, which is what they wanted to do originally, because normally 30,000 would not be OHP.
Yeah, there's not going to be an opt-out option. So if someone is applying through the marketplace system, if they're at that $30,000 income, the marketplace should be referring their application over to OHP for screening before it'll give them tax credits or anything like that through the marketplace. So that person's not going to have the opt-out option. The timelines for OHP Bridge enrollment are the same as Marketplace. The distinction being it's based on when the application's processed. So connecting with someone who can help expedite that application through so it processes before the 16th of the month would be, or by the 15th of the month, would be necessary to get coverage on August 1st. So we're past that for this month. We're looking at September 1st start dates for anyone applying right now. We have some graphics we can provide on the timelines for enrollment, but it really closely follows the marketplace rules for those determinations. For OHP Bridge, BHP, tribal members have different rules for the basic Medicaid program.
So in the meantime, they have no coverage.
That's correct.
Oh, if they're losing group, they'd have COBRA eligibility.
No, not in this particular case, because the company closed.
Oh, yikes, okay.
And Cobra would be like $1,200 anyway, which they can't afford because they have no job right now. So, and they have a surgery upcoming, so they're a complete mess.
If they don't have a job right now, OHP programs are based on current monthly income, and they might qualify for that as well. So that might be a regular OHP case. OHP uses current monthly income. OHP Bridge for most members will use annual incomes. There's a distinction there depending on what their
Yeah, the
income
annual
situation is.
income right now before adding any unemployment, because he's already applied, he hasn't gotten the confirmation on unemployment, it's 30,000. But he doesn't have a job, but he will have unemployment once he is approved because the company closed. So he's a mess.
Technically, if he hasn't been approved for unemployment, he doesn't technically have income yet. So he could go to the one system and apply and just report what he knows to be his monthly income, and then just update it once he gets approved. So
yeah, that would be if his August income is going to be below the traditional Medicaid threshold, he will be eligible for coverage back to the 1st of August, which sounds like that might be a strong possibility here.
I do want to mention that all of the communications that we are currently pushing out for the OHP Bridge program is routing folks to our website, OregonHealthcare.gov, in the hopes that people will use the window shopping tool, which Katie Button's going to talk about in 2.5 seconds. But because the goal is to get people to the right place the first time so that they don't get stuck, waiting for information transfers and so on. So that was my segue to.
Yes. Are we ready to segue to that? Okay. Hi, everybody. I'm Katie Button. I use she, her pronouns. I'm the plan management and policy analyst for the marketplace. Thank you, Dawn. For our folks who are translating, I will try to speak slowly, and for everyone, because I am a very fast speaker. So we do have some updates to our window shopping tool so that folks can have eligibility estimates for OHP Bridge. So we will have folks who are eligible for OHP and OHP Bridge will be shown the same messaging. And so when all members of the household are eligible for either OHP or OHP Bridge, they'll be immediately directed to one. And so the graphic that's on the right side of the screen is an actual screenshot from our tool. And you can see that yellow apply now box that takes folks directly to one. Like Amy was saying, we're trying to off-ramp folks to the correct application the first time. Next slide, please. So we know that lots of households have what we call mixed eligibility, which means that some folks are eligible for one program and some folks are eligible for another program. So we made sure that our tool can be used by households that do have mixed eligibilities. So for example, there might be a household where the parents qualify for OHP Bridge and their children qualify for CHIP, which is OHP for children. In that case, they would all be sent to one. There might be a situation like Ohm was asking about where there's a married couple where one spouse qualifies for OHP Bridge and the other spouse is 65 or older and is not qualified for Medicare. And so the graphic on the right side of the slide shows that scenario. And in that scenario, the spouse that is 65 or older would qualify for marketplace plans. As Sean mentioned, there's OHP Bridge Basic Medicaid for folks who are American Indian and Alaska Native. And so that has a slightly different income calculation. And so households where some folks are American Indian, Alaska Native, and some are not can also use the window shopping tool to be correctly routed. Next slide, please. So let's talk about OHP Bridge and healthcare.gov. So healthcare.gov is treating OHP Bridge as a Medicaid expansion. And so in most situations, that's going to work out just fine. There are a few situations where the eligibility won't work out quite correctly. As I mentioned, folks who are American Indian and Alaska Native have a slightly different income limit. It's 205%. So if they are between 200 and 205%, healthcare.gov will keep them in healthcare.gov, but they are eligible for OHP Bridge. So if they come to our window shopping tool, it does have that correct income calculation and will correctly route them to OHP Bridge. Folks who have lived in the US for 5 years and would not be eligible for Medicaid will not be sent from healthcare.gov because, again, healthcare.gov thinks OHP Bridge is Medicaid. So those folks would stay in healthcare.gov, but if they come to the one system instead, they would be eligible for OHP Bridge. There are some situations where healthcare.gov will incorrectly tell people they're eligible for OHP Bridge. One example is households who have access to affordable employer coverage. That's allowed under Medicaid rules. It's not allowed for OHP Bridge. So in those situations, healthcare.gov would send those folks to OHP Bridge. They would have their denial notice and they would go back to healthcare.gov. Next slide, please. So as Amy mentioned, what we are trying to do is just send everyone to window shopping. It takes literally about a minute to input your household information and see what program you're eligible for. And it will help off-ramp folks more correctly so that they're not filling out one really long application just to be told they have to go over here and fill out another really long application. Some benefits of our tool is that the Find Local Help tool is available on every page. So that gets folks to agents and community partners. So at any step in the process, if they're like, I really don't know what to do, there's help right there for them. They also can check the affordability of their employer-sponsored coverage, which is important for both OHP Bridge and Marketplace plans. And then Amy has put a beautiful new banner on the top of our OregonHealthcare.gov homepage, and it matches the communications and marketing stuff that Sean was showing. So if you click there, it'll take you to the window shopping tool. There's also a little pink Get Started button that will take you to the window shopping tool. There's a direct URL for that. It's OregonHealthcare.gov/window shop. But if you don't remember that and you just go to OregonHealthcare.gov, it's right there, very obvious for you. Are there any questions about window shopping before I move on to my next slide?
Can I just say one thing? It's also on the Spanish site.
Yes, thank you.
So just wanted to add that.
There you go. Keep going. Yes, last slide. So now we have a question for HIMAC. We'd like to know what you're hearing from your community since the launch of OHP Bridge, and recognizing that it's only July 18th, and so you might not be hearing a lot, but I'm interested in what feedback you have heard so far.
I get calls often, and I need to remember to refer them to the window shopping because of that difference between OHP Bridge and OHP in terms of qualifying for other coverage, etc. But no, it's a lot of news out there on it, so people are looking at it.
I would say from the user experience, we've had a lot of really positive. From the care coordination side, I've had some hiccups. Folks have temporarily lost CCO enrollment upon transition for a couple of days. We had for an example, had somebody that was for 3 days lost their CCO enrollment. It was backdated, but it interrupted care at our clinic. But we've been in contact with the CPOP team and some other folks, and so just to put that out there for folks.
I would say we've had a number of customer service calls, just questions, not unexpected though.
And does it look like anybody online has any other comments or questions?
So I know the committee had some specific asks last time about mitigation. Is that on someone's radar for next conversation?
We are still working on it. We just don't have any updates that we can give at this time. We have lots of ideas that we're trying to track down, but nothing concrete yet.
I see Tim nodding his head too. Okay. It sounds like you'll plan to keep that on your radar for reporting to this group, because I know folks are interested in hearing more, and including about what you've tried and isn't going to work. Okay. So we've got a little bit of a timing update. Chicky, was there anything you wanted to say there, or should we just jump right into?
So yes, so thank you, Lindsay, for flagging that my apologies, I made a mistake in putting together the agenda. So our break today is not at 11:30 to 11:45, it's actually 11:45 to 12 noon. And then, which crunches down our workshop time, from 12 to 12:45. So, but please know, if we can't get to all of the topics, especially the workshop time, we can always carry that over to the next meeting in October. So just wanted to flag that for everybody, and my apologies for my typo. And here I was thinking that I planned this agenda perfectly, only to find out it wasn't as perfect as I wanted
it too.
That's
no. We all look at the numbers and like, yeah, that looks right. So group effort. Okay, so then I think we are transitioning to state-based marketplace project updates.
All right, my name is Dorosita Mardashev. I am the project manager for the state-based marketplace. And today we're just going to share some project accomplishments and then show our typical timeline slide with you all. And then Victor will talk about the RFP timeline and the experience and capabilities we're looking for from the vendors. Next slide, please. So this slide just shows the accomplishments, milestones that we have achieved since April. Amy has been doing a wonderful job conducting partner listening sessions. That was completed on April 24th and the 25th. We have hired our IQMS vendor who provides the quality management services, ensuring that the project team is following standard project management practices, and also overseeing any types of risks and issues that they see as well as for the project. So they were hired back on May 1st. And then Amy, again, leading the racial equity toolkit activities, making sure we're being transparent and applying all the best practices to keep equity in mind. That was completed back on June 18th. And then we have our, so our first deliverable that we received from our HIMAC vendor, Blue Crane. They did a quality control review of the RFP document before we posted. So we took their feedback, incorporated their recommendations to the document before it got posted on July 3rd, which is a huge milestone. So it's out there. The RFP is on Oregon Buys, and we did a pre-conference with the interested vendors, and we are gonna continue to work through their questions, and hopefully we have somebody, we're gonna finish the posting. It closes on August 12th. So yeah, working through the details. So we're getting there. Any questions about the accomplishments? All right. Next slide is this slide should look a little familiar for you. We continue to remind ourselves of this is our baseline. We want to continue to work through the activities we plan to do for this project. The change from back in April, we have completed the quality vendor procurement. That timeline is done since we finished it on May 1st. The solution vendor procurement, that's where our RFP work is coming. We're tracking that work there. We are still targeting April of 2025 to get the vendor selected and contract executed. Within that timeline, we still have our stage gate process, the project oversight required by DAS. So we did accomplish having that stage gate 2 endorsement and working through stage gate 3 endorsement. Any questions here? Yes,
Did
Stacey.
you have a lot of engagement with people participating for the RFP? It sounded like you had a kickoff call, maybe. There was, if I heard that right.
Yeah, there was a pre-conference
Yeah.
There was about 10.
And is that good? I mean, is that what
That's good. That's good. Yeah. Through our market analysis, at first we had four vendors, so having 10, very good outcome. Yeah. So great response, and we'll see what happens on August 12th. All right. No further questions. We'll keep going forward. And this is Victor.
Hi, everyone. Victor Garcia, Operations Development Specialist with the Marketplace. Just talking a little bit now that the RFP has finally been posted and we can say that, and that's really neat. We'll say the RFP ends, or the posting, the submission requires that everything is in by August 12th. So we would normally call that the closing date. Oregon Buys calls it the opening date. So if you see opening August 12th, that means the same thing. So just in case that's not confusing at some point when that comes out. And then we'll begin round 1 evaluations right after that. And then right now we only have kind of scheduled for, we've only specified 1 round. It is almost certain there will be more. We just want to have the proposals in first, see where we're at, and then we can see what happens for round 2. Experience and capabilities that we've asked for in the RFP were that they must have at least 3 years of experience with an SBM solution in another state, and 5 years government experience, like working with state governments. So reason we went with 3 years is because these sort of second generation, what we're calling second generation SBM solutions, where they're sort of, the vendor does everything. It's a cloud-based solution. They do the hosting, sort of a package deal. They're relatively new and only in the last 6 years or so. So we wanted to keep our expectations realistic, but also wanted to make sure the vendors have good experience working with governments generally. So that's why the 2 different requirements. And then at least 1 key person must have demonstrable experience with working with SBMs and knowing ACA rules and compliance. And really that's almost goes without saying, but nothing goes without saying in contracting. So like if you've done the first 2 things, you have the 3rd thing, but we also wanted to specify to make sure that person, we get that person and that person stays on the contract as we move forward. Next slide, please. Okay, so I guess that was all we had for that. So, yeah, Stacy.
Can you go back?
What does the evaluation process look like? So is there a committee that's reviewing that? Could you describe that a little bit?
Sure. Right now we have a 7-member committee, and we actually have can send some information out, but we've kind of outlined from different kind of partners. So it's not just, we have a couple of marketplace representatives, but we also have 2 people from our state partners, so OIS for technical advice, and our external partners. So we've got good representation. Beyond that, though, there will be sort of an expanded, or those are just the people doing the scoring part for round 1, but then there's also like a bigger SME group that has kind of more specialized experience with different aspects of it to advise the reviewers. So it's not just them independently kind of scoring something, but having that advice from the broader advising group for the review.
So to add additional context to that, we are also including members of the public and the community, our partners and our grantees, and also our insurance carrier companies. If our team has not reached out to you yet, you will be getting a message here fairly soon. And please know that this model of, we have an evaluation panel and then we have our request for proposal advisors, is very much heavily borrowed from other states that have done the transition. We've consulted heavily with other states. Other states are fantastic resources. The exchange community is so small and niched. Am I pronouncing that right? It's kind of hard not to, kind of pass on best practices and lessons learned. So that was one of the most common themes amongst all the states, have your evaluation panel, but then also have your subject matter experts serve as your SBM advisors. And our advisors, I don't have quite the number yet. We're still recruiting, but it's going to be all across the board between Oregon Health Authority, DCBS, as well as OIS, DAS, DOJ, the community. So it's going to be a party, I think, somehow, some way.
And then just to kind of get at your earlier question too, the pre-proposal conference, the participation we had and the vendors that showed up. Actually, the market analysis we did was, I think, 4 vendors, but they also had partners like for call centers and stuff. So all the people we expected to see were the entities we expected to see were the ones that showed up, and sort of the nature of how that went was kind of what it went along with the picture we painted during the market analysis, which is that, these entities, these businesses already know our business, so we don't really need to explain that part to them. It's more going to be about the process and making sure we get the contract correct. And so far, they haven't let us down in proving that at every step. So that's why it's gone as quickly as it has, and I believe why we also can say we're still on track, even though we'd hoped to do this a couple months ago. We built in a lot of extra time for this procurement step, knowing that things can be weird, and they're often weirdest during this part. So we're in good shape, and the vendors we've seen so far reassure us that we're still in good shape.
Any other questions for the state-based marketplace core project team? So Dorothy calls us apparently the 3 Musketeers. We haven't quite landed on a formal name yet, but that's what we're going.
I don't know if it's the characters or the chocolate.
I mean, I'll go for the chocolate. I'm a big fan of chocolate, so we'll go with the chocolate. Yes. So of course, we're very excited. You all know this. We talked about this in the committee back in 2019. It was heavily recommended by this committee, and then through Senate Bill 972, 2023, and then we're here. We are going to be submitting a policy option package because we did very intentionally phase this out. We knew that there was going to be a planning phase, and then there's implementation, and then operations and maintenance. And we knew we wanted this project, we wanted to be very methodical and thoughtful. So this was a 3-year project. So we had our first anniversary on July 9th. So this project is definitely year 1 of 3.5, I think, if I'm not tracking or anything. So we are well on the way. We have really good resources and partnerships that the state is. We are getting fantastic resources, and from again, the state, our partners. I feel like the energy is there, and we're definitely going to capitalize on that energy. We're getting support from the governor's office, from the legislators, so we're pretty excited. So once we do have a policy option package that we have submitted to put forward for the agency requested budget for next year. Long session starts in January, so it's going to be interesting and fun times because we're also working through the project, stage gates and whatnot, as well as the legislative process to get our budget approved. Any other questions or any other requests for information? Please know this will be part of our baseline work plan for the Health Insurance Marketplace Advisory Committee 2025, 26 and onwards.
It's all, yeah, this is just a fun questions. What, if this SBM going to be effective, with the election this year?
So our state-based marketplace, I'm not entirely sure how to answer that question, but our state-based marketplace will launch November 1st of 2026. So we are still a few years away, so technically not in an election year. So if you can expound a little bit more on if I answered your question or if you're looking for additional information, I want to make sure I am responsive.
No, I just, as a curiosity, because I know it's a bill. So meaning, let's say if some other group coming in, they will not kill this bill, right? This will be continuing as to get to the finish line. That's my point. There will not be interruption regardless of who become a administration in the state or to the national.
As of today, it's still going to move forward. Of course, we can't predict what federal or state government will do and guide us to do, but we will definitely be watching that for any changes because I'm sure that will impact not just the SBM, it's going to impact marketplace and open enrollment and all the things that we have been working on for the last decade or so.
All right, thank you.
Thanks, Owen.
When people ask what keeps me up at night, that's kind of at the top.
At least not that.
So we will be back with more updates for sure. If not through email, we'll definitely be back in October and all our meetings because this is I feel like this is a pet project of the committee. So we're happy to we're happy to be a standing agenda item.
I assume it'll be on the agenda every session from now for the foreseeable future. So thanks for the update.
Okay, and I'm up. This is Nina Rumpel. I am the Marketplace Transition Program Manager, giving you updates on what's been happening. So here you'll see that since September of last year through July's outreach for the OHP request for information non-renewal response, we have done outreach to 145,000 people. We have gotten all of our files for July from the passive renewals that have been going on for the OSIPM and ex parte cases, as I've mentioned in the past. Next slide, yeah. So our project so far, here you'll see that 123,000 people were referred to the marketplace, of which we've sent out 88,000 letters. And you'll see here the numbers, and you can always go to our dashboard to see the small numbers more legibly. Next thing. So far, during the initial year of the project, we had averaged 9,000 plus OHP and eligible members each month for referrals to the marketplace. The average number of individuals for outreach was 7,881. Currently, April to June of this year, monthly averages are about half of what we had in the first year because we have completed, OHP has completed so many of the renewals. Nearly 90% of those have been completed. Our inbound calls, January through May of this year, totaled 2,800. So of those that called in, 54% requested and received assistance with Marketplace. The other folks were generally OHP questions that we referred to the OHP call center. we sent out a survey in June to folks that were referred to healthcare.gov but had not taken action to enroll, as well as some outreach to some of the folks that did not respond to the RFI from OHP. So here you'll see that over 100,000 text messages were sent, over 40,000 emails were sent, and then in the blue bar on the graph here, you'll see those were the number of folks that responded. We had done outreach, phone call outreach to over 3,000 people that represented by the responded that requested more information. So again, we sent out the surveys to why haven't they taken action, or do you have other coverage? And we had a number of people that said, I still need help. I didn't because I still need help. And so we did the phone outreach for those folks.
I have a question.
Yeah.
Is it surprising to you that there's nothing returned on the emails?
There is a little sliver. You can just barely see.
Okay. I kind of see it now.
But that being said, it's not surprising to me. People don't open emails that they don't recognize. So we tried to make it as flashy and
yeah, no, the text results look good.
Yeah, and two, the folks that did email, if there was a spot for contact information,
Sure.
if they provided a phone number, we also made a phone call. We responded by the email, and then we also called them and let them know that, so we tried to make sure that we provided as much help as quickly as we could for them. Okay, so here with these survey results, you can see in the bottom left corner, the yellow, that's in response to the question about did you window shop? Did you use our window shopping tool? The yellow represents the no, they did not. The pink wedge is about 15% of the respondents said that they did use our Oregon healthcare.gov window shopping tool. The teal wedge is about 15% completed healthcare.gov application. And then the blue shows the folks that used healthcare.gov plan comparison tool. Next slide. So the impacts of the OHP processing issues, now that they've started sending or making the redetermination for renewals for the OSIPM and ex parte cases, again, allows a time frame of 150 days from when they get their first notice to reconsideration periods. They get a notice after 90 days that you're going to be closing within 60 days, and then they get another set of time that they can be reconsidered and not lose coverage. So for that reason, because the last redetermination cycle will be September of this year, pushes our work with the RFI file into January of 2025. And so we will continue with our vendor contract and temporary staff. We've extended to make sure that we meet the requirements that we've set so far for ourselves. Again, just giving you resources on how to help people that may be asking about losing benefits. Again, the SEP special enrollment period for people that have lost OHP since March of 2023 goes through November 30th of this year. Any questions? All right, thank you.
Thank you. Do we have anyone who's signed up for public comment?
Let me see. I lost track of what was in the chat, but I assume it's unrelated to public comment. Yes, okay.
Yes.
All right, I figured I should check.
So if anybody would like to speak during our public comment period, please unmute yourselves. I don't believe there's any special dial-in, like a pound. No. Okay, so just please feel free to speak up. Now is a good time for public comment.
Again. A public comment on the bridge plan. You know, when we look into the income for a single person at a $2,510, so my calculation is about below $16 per hour. And you know, I could be naive because I pay my employee a lot more than that, and there are quite a lot of people still earning that $15 per hour, or below $16 per hour. Is that the income, if you want to really help people who in between the 200% FP out, is the income should be a little bit higher? That's my comment on the OHP bridge.
I cannot see, just out of curiosity, is Tim still on?
Oh, it's just a comment. That's okay. I'm just like,
Yeah.
you know, I think after COVID, I think it seems like every place is paying more than $16 per hour.
Okay, thanks for clarifying. It wasn't also a question. Got it. Hands. Okay, I think that might be.
You're only 3 minutes behind schedule. Look at that. Thank you, everybody, for making it up. So if we are ready, Amy has a lot of things, interesting stuff. If you've had the chance to look at our slide deck, we have some fun stuff. Sorry, it's fun for me. I'm hoping it's fun for you too, to talk about. So I'll pass it on to Amy.
So hello, everyone. Amy Coven. I'm the Communications and Public Engagement Analyst for the Marketplace. And so I've been kind of leading the work for public engagement and equity work for the state-based Marketplace project. And I'm really excited to share with you guys what we've been doing and kind of thinking about. So just to kind of level set and make sure we're all starting from the same place, wanted to make sure that you all know what we've been holding as our goals for community engagement. First, we are wanting to make sure that we are bringing clarity to the project and to anyone who's really kind of looking in on the project, so they understand specifically what we're hoping to do and achieve and all of that, and to avoid confusion. We're working hard to align the expectations of our project and all of our partners and staff with the goals and objectives of the agency, including the agency's health equity goal. We're really working towards accountability, or I guess I shouldn't say working towards, we're holding everyone accountable, including staff and vendors, to make sure that we're meeting the expectations that we've established. And also, I would say probably one of the biggest pillars for me is this feedback, working really hard to get feedback from partners, internal sources, external sources, and really making sure that we're providing, not just receiving feedback, but providing commentary back so that people really are feeling heard, and making sure that those voices are really elevated within the project. Next slide. Thank you. So this is a lot of words, and I'm not going to read them all because I'm sure you guys are good at that. But we just want to kind of highlight who we have identified with the help of, we had a group that we convened to do a workshop on equity, and they helped inform this list as well and helped expand it out a little bit. So we've identified that consumers are obviously going to be impacted, moving from the federal marketplace to the state-based marketplace and managing their enrollment. Insurance agents and brokers who assist with marketplace are going to be impacted. Assisters at community partner organizations, both for assisting, both of those groups for assisting clients through the marketplace. And we recognize that insurance agents and brokers and assisters use the marketplace currently in different ways. So we're being very mindful of that as well. And then insurance carriers, you know, are going to be impacted, having to submit through a different portal, work with a different system, and so on. The insurance regulator, you know, who handles the complaints, we're going to be working very closely with them to make sure that they're kept informed of how things work and things, so we can work through those together. Our tribal communities, we want to make sure are held at a very high priority, because we want to make sure that folks understand the change, and really build upon the knowledge that we've shared already about the unique benefits available to tribal members, and hopefully get some more buy-in from our tribal communities. And then making sure that the ODHS and OHA eligibility staff are really tied into and aware of what's going on as well, so that as they're getting questions from folks who maybe aren't eligible for OHP or are no longer eligible for OHP programs, that they understand how to guide them into other coverage options. Next slide, please. So we have taken some time to identify opportunities for questions and community and partner input. This is kind of this is not an all-inclusive list. As opportunities arise, we will be, you know, obviously adding those to the list and using them. But in the planning stage, we've been really working hard to, we've gathered a lot of insight into experience of using the current system and what we can do to improve upon that experience as we move to our own system. In execution, we have a lot of opportunities that we've identified. I think that'll probably be the biggest areas of opportunities as we're actually working to implement the new system. So we're going to be looking for a lot of feedback on communications, experience, branding, application flow, just the whole kit and caboodle. Monitoring and controlling, we want to make sure that we're getting feedback on, again, the continued communications mechanisms and what we're sending out. And we'll be getting feedback on the actual drafts. And then we want to make sure that we're also getting feedback on that first year of open enrollment. And how did things go? How was the transition? You know, and how we can kind of smooth things out a little bit for the kind of going forward. So I have a lot of discussion slides, so I hope you guys came prepared to talk. So the first thing that I wanted to talk about was those first few slides. Just if you see any additional opportunities of where we might be able to partner with communities, you know, using data to help inform our decisions and et cetera. So we'll stop talking for a few minutes.
When it comes to partnering with communities, I think nonprofits are the way to go. Mainly because back in 2013, partnering with nonprofits, I saw the impact because everybody was already flocking to them because they're part of the community. And then they were doing the outreach, and then they were pulling us agents in to help out. And then when there was questions, they'd go back to the nonprofit, and then they go, okay, now you need to talk to this person. So they were the ones that were really being effective in the community because they're trusted, they're known, and people know they're there. So I think community partners such as nonprofits, whether they're part of our community or not, it doesn't matter. I think that reaching out to just local nonprofits will then reach out to those communities. So I think that's going to be very important. You know, even if they're not doing applications for Oregon Health Plan is where I'm trying to get at. It doesn't matter.
Kind of those auxiliary gatekeepers for the community. So
yeah, they can then be the resource and go, okay, we don't do that. However, and if the calls are coming in or if the people are walking in, then they know who to connect them with, or, hey, do we have an event there? You know, like we did in 2013, do an enrollment event. That was huge. It was all about coming together, and it was like 20 people helping, and then it's like line out the door. So I think that's going to be, if you want to get to communities or within, it's through nonprofits, in my opinion.
Thank you.
Thanks, Tom.
We're
on the same page.
I like how it stays on the screen on here, not whereas Teams it just kind of.
I would agree with that. I would also kind of just to expand on it a little bit is the community events. Like there's so much going on in all of these. cities and towns across the state, that if you can dial into those community events, have a booth, have people there to get feedback, to be present, and maybe that's part of your plan. But I just think that that would also be a great opportunity.
Yeah, we definitely, just to kind of expand on that, Stacy, we have a really robust outreach team, and they're always in the field already, kind of building that brand awareness for the marketplace and sharing information, not just about our programs, but just connecting people to whatever coverage program is best for them. So we will be maximizing.
Aligning with events, like some of the community centers in small rural towns that have, they're connected to a hospital, but that community center will put on events, right?
Yeah.
The nonprofits will have events that are going on that they're part, that they, like, it's on their radar, and it may or may not be on yours. It's just how you can partner with them to really get dialed in.
Yeah, kind of like they do the Hispanic fairs, or just the balloon festival in Tigard. I know that out in Ontario, Oregon, they're having a rodeo going on right now. My niece captured 2 pigs. That's why I know that. $100. But events like that, it's bringing the community together. So yeah, that's we don't normally see. And people aren't there for that, but that's also the place where they go for information, where they're like, oh, what's that going on? And then gathering like, oh, I had no idea. So yeah. The chambers have a lot of events too.
That's where I was thinking.
Yeah, that is a good one.
Well, the nice thing about those, it helps those backup connections. Like even when you cast a wide net with the nonprofits, there's just so many different micro communities too, that some of those nonprofits have connections amongst themselves, but to have some of those just more generic community events, just more chance to, I was going to say catch someone in the net, but it sounds weird. But to, make sure that the message is out there.
No, like right now, Rotary, like the Moose, the Elks, like Rotary, we're doing 4 weeks of summer concerts in Wilsonville. So we're bringing in between 1,000 to 1,500, sometimes 2,000 people over each week for 4 weeks. And so it's a captured audience. People are there checking out all the vendors, and the market, the farmers market is now part of the farmers market. That's another farmers market is another place. So those are when people are out, because if they're not out, they're not going to make it a point to go out unless there's a reason for it.
Could you speak a little bit about the potential budget to support conversations with individuals from impacted communities, sort of to avoid some of the tax on asking folks for their time and feedback? Have I asked something complex? Not my intent.
No, it
seems like an issue.
That's a complicated question at this time, primarily because we, as a state agency, have to go through the process. I'm sorry, this is Chicky Flowers. I keep forgetting to introduce myself for transcription purposes. Because we have to go through a process where we have to submit our budget, and it goes through to the governor's office, and it has to be legislatively approved. So that in itself is a complicated process. We do have to take into consideration, so I don't have the best answer that at this time, other than we are trying to make sure that the user fees that we will end up having to charge for the state-based marketplace will ideally not differ from what we're currently paying for healthcare.gov and then the Oregon version. So we are going to have a limited budget. It's going to be a tight budget. I can at least say that at this time, it's going to be a tight budget just because of the transition year, and it is an IT project, as well as because of OHP Bridge, we are expecting less people in the marketplace where we have to generate revenue from. So we do have all these other challenges. I don't have specific numbers at this time, but I do know these are some of our known knowns of what we have to work with. So we will be looking for a lot of free or low cost opportunities. Working with a community that is not ideal. We know this from years of being a state-based marketplace on the federal platform, but those are our current obstacles that we will need to figure out in the next couple of years.
I completely get that. I just think that, and you of course spoken to this, that runs counter to the equity goals that you all have in terms of that engagement.
Yes, we didn't say this was fun. We didn't say it was going to be easy. Thank you for your question, Lindsay.
And this is Paul on the sort of the data question. I guess, you know, feeling I don't really know how much data you have access to, but like it feels to me like we know there are differences by community and by region and by all of those places. And at least then, maybe to Lindsay's point, when we have limited dollars, like, hey, where can we get the most from them? Where's that most opportunity? And you know, having options everywhere, trying to have options for, you know, but when there are funds, direct those funds to where that can be most useful, where the community would most benefit from it. And, you know, when it's a hard choice, but I think that's where certainly I would hope the data could come in to sort of highlight those gaps.
It's helpful, thank you. Well, we can move forward, I think, yeah. So I just wanted to highlight a little bit, we've held third round's coming up next week. So we've held 2 rounds of listening sessions so far. So I just want to share with you all this, and I'm going to kind of speed through just a little bit, but we do have reports on the listening sessions on our transition or our SBM project website. So if you want to see all of this data in more detail, I encourage you to look there, but just for time. So just to, again, to level set for the listening sessions, we're really looking at getting, for the first one, we were looking at getting feedback on healthcare.gov, the current experience, and then what we could improve on. So we really encourage participants to avoid discussing things like policy, health coverage affordability, network adequacy, you know, all of the hot topics that people think of, and we love talking about. But we really, for this purposes, we wanted to focus on the actual system. So on the next slide, this is a little bit, this is to just show for the respondents of, we sent out a survey, and then for the listening sessions, how folks rated their experience using healthcare.gov. And you can kind of, you know, see here, you know, there's not much more to add, but this is like what we gathered. And you can see that insurance carriers, you know, we want to build upon that experience and hopefully make it a little bit better with a state-based marketplace. And on the next slide, and I recognize, again, there's a lot of words on here, but this is a summary of what we gathered for you know, what we heard in terms of the feedback, a little bit more granular data. We did highlight some of the reoccurring themes that we heard and the things that we really identified that we would like to kind of, I don't know if immediately approve upon. It would be, you know, kind of our goal. Of course, that's a little bit with the caveat that we don't know who our vendor is or what their, you know, capabilities and all that is, but those are kind of the things that we're really looking at hopefully improving upon. And then the next, again, a lot of words, I apologize. But these are what we heard. A lot of folks, you know, say that they would hope we can improve upon in the new system. Again, we bolded what we heard more frequently, and what we are hoping to really focus on, you know, with the new system. So we're keeping, I do want to say that we're keeping these lists kind of close to the chest right now. We have a report out that people can look and see this information, but we also don't want to, you know, hurt the vendors, you know, give anyone an unfair advantage or anything like that. We want to know what vendors can do, and hopefully some of this will be built in, and then we can talk to them about the things that they don't mention to see what we can build upon. So
can you expand on that a little bit further? So, because this work was done like the last couple months.
So this particular one was done in January for this particular, yeah.
So did that inform like your RFP questions and like how you're maybe scoring? Is that true?
I'll let Victor, yeah.
Victor Garcia again. It did definitely inform what we put into the RFP in terms of what we were asking for. The scoring is a natural outgrowth of all the things that are kind of in there. So it didn't really change how we were thinking about it because we were mostly worried about, well, requirements like all, can you do at least these things, but also sort of your plan. And I think having most of the points invested in sort of like their outlining of how they were going to do an implementation really also hits something like this where we have these considerations from these interested parties, and the plan needs to address how like there is an agent portal, what the agent portal does, and, or tools for carriers to try and take care of reconciliation discrepancies, things like that. So that. Yeah, it definitely informed kind of more specifically what we would look for when we receive those things.
And I would definitely, I mean, from my perspective anyway, and I've had the advantage of kind of being in the field and working, one-on-one with the sisters and agents. So a little bit of that perspective as well. But a lot of what we heard in these listening sessions, I think just kind of reinforced what we already kind of had in our brain. So it just kind of gave us the ability to bold it on a list and say, this is kind of our priority. Yeah.
I'm glad to hear a question because I was mainly looking on the insurance agent side because that's where my space is. But under the assisters, one that's bolded, it says, do not allow someone eligible for OHP to purchase marketplace coverage. Well, the marketplace doesn't, if they qualify for OHP, it doesn't allow you to purchase marketplace.
Yeah, there's been some instances where we've heard of some issues with the communication between the systems and like the data checking and things like that. And so I think it's more along the lines of the systems not communicating as efficiently or as well as we would hope, and or like information being put in different into the two systems, so they're getting different outcomes. So it's more to just kind of alleviate some of the constituent issues that we've kind of ran into. That's what we've gathered.
Yeah, because sometimes I'm going through and all of a sudden at the end, it's like, well, this person qualifies for OHP, you don't, but they do. And so it's like, well, then, yeah. And then I send them off to an assister to get help with that process. So I'm getting the opposite where I've not come across that. So.
Actually, our next slide. So this is, our second discussion opportunity here. So we just wanted to hear a little bit of feedback. I know that those lists were very long and maybe overwhelming, but if there were any, desired improvements or feedback that you saw on the list that we hadn't bolded, if you thought that we should have, or if there was anything that was missing that we should be adding. And recognizing there's a lot of information on here. So if you don't have immediate feedback, we are happy to take it. Yeah.
One thing that I know and will probably agree is that we've been helping folks through Marketplace for 11, 12 years now. Consistency is going to be huge. Not changing the system so much where we're having to relearn something that it's like, again, because we've had to do it already twice. And so we want to make sure that it's easy for us to be able to put in the information and go through the process pretty close to what we have right now. I mean, we have it down using our like Health Sherpa, and there's others out there, but just the flow of it, we're used to it, and it falls in line with healthcare. If you're on healthcare.gov, it's different, but it's the same at the same time. And so we know what to expect. We know what's next, and I did see, being able to jump from one area and then being able to go and skip, that's huge. But just having that nice flow, so that way we're not having to relearn and take that much longer to re-input everything. That's the other thing. Is the information going to be picked up from healthcare.gov and dropped, or are we starting from scratch?
The goal is to have the data migrate.
And is it going to be all data or just 1 year data?
All will have to be all.
Yeah.
Yes.
Okay. Even if it's archived, we don't care. Just because now we have 3 systems to go into. So that's my feedback, is make it easier on us. I don't know what the assisters think, but from the agent standpoint, we are so darn busy. We want it easy peasy, not frustrate us because we're not gonna be happy.
But that's our goal, is to make it easy.
Thank you.
And Amy, what might be helpful, it's hard to look at the little print
Yes.
minute up there, but, and so maybe this was done, I couldn't see it, like the emails. The consistency among all three groups, like, for example, the local call center, I mean, it's awesome, and, if that was in all of them, I think that would be very helpful to call out, because that, if you make a change, it's gonna impact all audiences. I just couldn't tell that, it looked like what was bolded was like what the common theme was for that group. I'm just suspecting that there's things that are gonna be shared for everybody that you might wanna focus on.
This is Paul. The thing that occurred to me with the window shopping piece is to the level that it could be integrated just as soon as possible to redirect people to the right place, just to sort of avoid, typing in all of your demographics, all of the things, and then eventually be saying, oh no, hey, guess what? You're eligible for this other thing. Congrats. Like, it's still a good thing, but just to have it be more smooth, I guess.
Katie is usually all up on that, so I don't doubt that that's going to happen.
Yeah, this is Nishoba. I was seeing and completely agree with a lot of those concerns, specifically around identity proofing. It's a huge issue, I think. Yeah, I think the assisters and agents do share familiarity with the platform. You have to really take into consideration self-driven and folks applying on their own. Documentation, that approval process and timeline has been really cumbersome for folks that have to submit documents. Confusing and really cumbersome. I saw those listed. I really wanted to highlight that. And I would say, we have such an opportunity, moving into a state-based exchange, that for those that need to be connected, like even like mid-process with agents or community partner within their area, and that connection, I'm interested how that's going to potentially look. So OregonHealthcare.gov, internally on one website where they build defined community support or an agent, and how that would route, live, I think is a really big opportunity. I'd love to be able to see that kind of work seamlessly, live. So yeah, I saw some interesting ones on there that probably aren't on a lot of folks' radar about, just access. Folks are having a really hard time getting their login, understanding password, those security questions. Those are the things that hold up the process and might seem really rudimentary, but those have derailed countless sessions, and are a huge barrier, so.
Yeah, Gladys again. One of the things that using the health Sherpa, being able to find somebody that's on healthcare.gov because they started it or they got the denial from Medicaid, being able to find people makes life so much easier. Whereas before, going back to what Shobha says, is they don't remember the user ID, they don't remember the password, having to reset, they change their email. It just, being able to have that access, even if it's not, similar to where we have access without having the direct access, that is really nice. I love that, because then people, they can still keep their healthcare.gov. I don't have to know any of that, but I still have access to doing all their things here.
Right.
So having something like that, where even if it's within the same system, having a separate platform for agents where we can find people and we can take over halfway through, and being able to do that, I think that's going to be huge. Not having to try to figure out or start all over, because we're trying to. I don't like duplicate work.
Yeah.
And when I go in and I find somebody and there's 3 applications, I'm like, oh. It's like, okay, which is the latest one? Let's, archive the others, things of that nature. So I think that's going to be important for agents also, in being able to find and help and access and not have to keep track of other people or delay yeah, in the middle of open enrollment, we're trying to get people through, not, spend an hour just trying to reset password and then, oh, now we have to schedule another meeting because I gotta go.
Yeah. Thank you. All right. Well, let's move forward. Oh, yep, go ahead.
Actually, because it is already 11:45, I think this seems to be a natural, I'm gonna keep to the schedule, because I said I've already made a mistake, we're gonna stick to the schedule. Plus, we already have our food, so I think if chair, vice chair, okay, so I think.
Pretending to be chair for the day.
So it's 11:47, if we can, for those on the phone, we are going to take a break for the next 12 to 15 minutes. So let's plan to come back at 12. For those in the room, your lunch is ready. We tried to pre-package so that we can, we'll have a working lunch, but please feel free to do what you need to at this break. So again, we will come back at 12 o'clock. Thank you.
Stand up.
out on Zoom. Sorry in advance if we rustle our bags. We're doing our best and we're excited to be here in person, so we're chatting.
All right. This is Amy again. So we're going to jump in. So earlier, Dorothy mentioned that we finished our racial equity toolkit. I just want to clarify that we worked off of a number of foundational documents, one of which was called Racial Equity Toolkit, but we're actually calling it now the Equity Focused Health Impact Assessment, because we thought Racial Equity Toolkit was too short and simple. I'm just kidding. So this assessment is broken down into different sections. We're not going to have time today to discuss all of them, but I'm happy to bring it back to you at the next meeting or when we have time. But we do have a couple of sections that I wanted to discuss. So the first is community engagement. So to develop this assessment, we did a number of things. I started first with our internal team to kind of talk about with the different subject matter experts on our team to kind of get a baseline. And then we did, as I mentioned earlier, we held an equity tabletop work group meeting, and we had folks there from ODHS, OHA more broadly, DCBS. We had someone from the Division of Financial Regulation and from their equity team. I'm trying to name, we invited Employment Department. I think I got everybody. And so we really used that tabletop discussion to really help inform this assessment as well. So these are all what came out of that. So accessible communications is one of our biggest goals, and accessible outreach when we're thinking about our outreach work for this project and really more broadly, but we're talking about the state-based marketplace project right now. And so we want to make sure that all of our communications are, first of all, making sure that we're routinely defining what the marketplace is. I think we all know that folks don't generally understand the marketplace, so just kind of reinforcing that continuously using plain language, making sure that we're using mechanisms that people are already using to get information, so we're not creating something new as much as we can. Making sure that we have equitable access to information so that we have a variety of languages, formats, like audio, visual, and written. That was a soda for everyone.
Yep, it was really subtle.
Sorry. And not only making sure that we are translating materials, but we're really transcreating materials so that the information that we're providing to non-native English speakers really resonates with them and doesn't look like it just came from Google Translate. And then for accessible outreach, making sure that, again, all of our materials are accessible to folks that might have disabilities, that we're providing that in-person engagement that you guys mentioned before. So that's definitely on our radar. And then making sure that we are coordinating any engagement opportunities with partners that we've either already established or where we can create new partnerships and build upon those. Next slide. So when we talk about outreach, every year since I think probably the inception of the marketplace, we have always worked to identify the communities of focus for our outreach so that we can really be mindful of what events we're going to, where we're going to events to really reach the people who are harder to reach traditionally. And so these are the audiences that we have traditionally put as kind of our priority audiences. We try not to use the word target because it's just not fun. Yeah. So these are our priority audiences. And these will be really the audiences that I'm envisioning that we're going to carry forward as our priority audiences. I don't think there's been much change in that. But this is kind of the foundation that we're built on. Next slide, please, Dawn. And so another part of our considerations is training. We know that there are, 3 primary groups that will need to be trained on the new system, both on using the system and interacting with the marketplace and understanding coverage options and the whole kit and caboodle. So assisters that are currently we are doing a state-based training for assisters. So that will obviously need to be updated for the new system, but we have a really solid foundation there. So that frankly, we're pretty proud of. So we're really, really excited about building upon that and enhancing that training. And we do offer that training. For those of you who don't know, we offer it in person, and then we also have an on-demand option, as well as I think we do still do some live virtual trainings as well. So really working it to make it accessible. And then for insurance agents, currently all of our insurance agents have to be trained through CMS, but we will be looking at pulling that in-house to make it a little more consistent with our sister training and with our marketplace. And then also making sure that the support systems and navigation is built in, from the ground up, so that we're not having to hopefully finagle that as we go. So. And then for consumers, there's going to be some consumer training as well. We're going to need to make sure that folks understand what's going to happen with their information, what this move looks like, how much effort do they need to put forth, right? How do they update their information? How do they manage their enrollment? All of that kind of good stuff. So, and I do want to say when we're talking about consumer training, we're not talking about an 8-hour sit down and learn the things. We're talking about mini informational videos, how-to sheets, things like that. So, and that's not planned out yet. So we'll get feedback on that, but kind of what we're thinking. Next slide, please. Communications mechanisms. These are the communications mechanisms that we've identified and the languages that we are planning to use for each of those mechanisms. I do want to say I'm really excited about this project, but this summer we're currently working on making sure that all of our materials are translated into all of the languages listed on the screen. So that's an active project that we're working on. And then we will also, for the notices piece, we've got a really good foundation because we've already been doing all of our transition project notices have been in all of these different languages. So we've already kind of started that, laid the groundwork, so to speak, and excited to continue that forward. Email and text message are a little bit more challenging to do all the different languages because of all the special characters and things that some of the languages have. So currently we're planning on doing email and text message in just English and Spanish. And then website, we have our English website. We also have our Spanish website. So making sure that we have that information for both of those groups. And then we also have Google Translate, which I will be the first to say is not the best, but it's the option we currently have to make sure that all of the folks that speak all the other languages can get the information in their chosen language. Auxiliary or accessibility information. I do want to mention that these are a lot of things that we are already doing. So it was somewhat easy to put this list together. But we do want to make sure, we wanted to be really mindful to make sure that we're calling this out so that we're setting the expectation as we move through the project that we're really holding these values key. So, currently and then going forward, of course, we do accessibility reviews to our website. I'm, honestly constantly making updates to our site to make it more accessible for folks, for screen readers, et cetera. Making sure that, we've got accessibility measures for all of our assisters and all of our insurance agents. We want to make sure that folks are able to get that help, really regardless of any accommodations that they might need. Buildings are ADA accessible, et cetera. Making sure that we have the auxiliary aids and services, large print, braille, electronic, making sure that we have ASL or other interpreters, closed captioned, et cetera. And you can kind of see on here, we do really work hard to make sure that our information is at a 6th grade reading level or lower for the public. Now, I will say that with health insurance, that's very, 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 very challenging. And the challenge comes in that we can plain language everything, but then we start looking at changing things like network, you know, we don't want to use a different term for network because that's not what the insurance carriers, you know, they're not using those different terms. So we're being very mindful to lower the reading level, but also keep consistency with, you know, industry standards and so on. So next slide, please. Okay, so you guys are chewing, and I'm sorry for that. But if you have a moment between bites and would like to provide input, are there any other types of outreach that we should add, that you can think of that we should add, or communications mechanisms or accessibility considerations, et cetera? Oh, that was a lot, right?
This is Paul. The one thing that I don't even know how feasible it may be is when I think about accessibility, some of it is just time. And so it's the, you know, for certain folks, it may be early in the morning, could be late in the afternoon, could be a weekday, could be a weekend, and just how to, and I know the websites and things, but some of that more concrete assistance, I guess, to make it more accessible is to have those resources available, not 24/7, but something, and I don't know if, I honestly don't know what's currently available, but that's what I think of as just, you know, people who have those off-schedule shifts or work or care or family, and being able to accommodate those folks too.
And Paul, just to make sure that because I'm taking notes too. So when you say resources, you're talking about the phone, like the phone lines, and then I'm assuming like also maybe if there's assisters or insurance agents that kind of have those weird hours.
Right, sort of staggered availability. So
chat, yeah.
Yeah.
Okay, thank you.
Not forcing someone to have to schedule around their life to be able to, you know, get the help they need.
Around state hours.
Yeah.
Could you talk a little bit about the languages that you've chosen? Like, how did you come up with that list? And like, is there, I mean, I'm assuming why you would just up like Spanish, I guess, as a website. Maybe that was one of the higher ranking languages, or?
Yeah, that's a great question. So knowing that we don't have access necessarily to the data to tell us marketplace enrollees preferred languages, but what we did was we looked at the OHP languages that are most requested by OHP enrollees. We also looked, so a lot of this list actually came out when we were planning for the transition project, because we were looking at who is moving to, you know, the marketplace potentially and what languages they might speak. So that list very closely mirrors the OHP member communications list. There's not a master like guideline list that OHA or ODHS has. It's just kind of arbitrary. So we just basically looked at like what are the top languages that are requested by folks in Oregon that are requesting OHP. And so that's, yeah.
Is there like somewhere in the Oregon databases of these like demographics, what languages people speak, so that everything?
That's a good question. Yeah, I've done some digging, and I haven't personally found anything, but I'm sure there's something out there that I just haven't found yet. So that's a good question
to see if it just kind of validates that you're on the right path versus you're missing a whole potential language that is in a area that you really want to target.
I will work to do that. Thank you.
Census data, help with that?
Possibly. Yeah, I'll see what I can do. I'll do some more looking.
This is Ron. I'm gonna go back to Paul here for a second. I know when I do my annual training, they ask your agent information, but they also ask your availability, as I recall. So I wonder if there's a way that the report can be done to show availability of agents in the evenings or weekends.
Like the something on demand, agent on demand?
Well, it's the, where we register every year, you have to update, and there it asks your availability.
Yeah.
And so I'm just saying that if the state can run a report to show how many agents and number available after normal work hours, weekends, etc.
I will definitely say that our Find Local Help tool is something that we're going to be looking at upgrading in this whole process. So There's a lot of opportunity there, I think, to enhance, it'll depend on capabilities of the vendors that we choose and things, but I'm hopeful that that will be something that we can build in as like someone with evening availability or something like that.
That makes sense, because sometimes, I've taken people 11:30 at night because she gets off at 11. I can do 11:30, like, really, yeah, I'm gonna be out, take care of you. And so having that availability even, and people are reasonable too, if they're trying to request something at 2 a.m, they know that it's like, well, I'm not gonna get anybody till probably 8:30 in the morning.
Well, I've worked graveyards quite a bit, and I can tell you that people that work graveyards accommodate the normal working schedule. Yeah, that's what you gotta do.
Has her.
Yeah, Amy, well, bon appetit, everyone. Seems like you enjoy food. Amy, can come back again to language. Is it possible to request another language to add on that list? I have quite a lot of, Thai and Laotian. Laotian can read Thai, but I don't see Thai is there. Is that possible?
Yeah, I mean, this is definitely, I would say a document that's a living document, so we can definitely make enhancements. Yeah, I've made note, thank you.
And I'm learning about something through, the person who's going to help me do, actually the company who's going to help me do website, they said that can you toggle to, change the language from English to some other language. But I don't know how accuracy would be. You have any experience with that, or this is something is on your research too, because the technical term could be so difficult to translate.
Yeah, all of the Oregon.gov websites right now do have a Google Translate option. It's usually in the upper right-hand corner or the lower right-hand corner. So you can toggle that and it'll change. I don't speak any other language other than English, so I can't speak to how great it is at translating. It's not great, Chicky thing. But it does use the Google Translate technology, which I hear is getting better, but it's still kind of AI computer. So
you said it's on OregonHealthcare.gov?
Yeah.
Oh, I would try that. All right, thank you.
Thanks. Well, go ahead.
Just following up on you can also just have, even in the intake process of the getting an application of, is there a language that this would have been easier for you to sort of just collect the data? Like, even if you can't find census or other data, at least collect it from the people who are trying to use the system.
Thank you. I think maybe we continue on. Is everybody okay with that? I'm gonna skip this slide. Yeah, there we go. Okay, no, we're not having a second break. Sorry, guys. So another area that we wanted to discuss today that's part of this assessment is evaluation. So currently, we have established that these 4 channels are our primary mechanisms for collecting feedback from external sources, internal sources, et cetera. So, and then we gather all the feedback here from meetings and listening sessions. We also don't have it on here, but we recently created a form that's on our site where people can submit questions as well, and it all routes to a really cool smart sheet program, and we can all see it and answer it. So there's that as well. But these are our primary collection mechanisms. And then next slide, please. And so what we are doing and we plan to do going forward is to gather all this feedback, bring it back to the project team, loop in any subject matter experts, from the marketplace or externally that we would want to loop in to try and analyze that feedback. And then we do plan on sharing that feedback once it's kind of been all analyzed and everything. We're still working out the mechanism that we will use to share the feedback. So that's TBD, but that's our plan. We haven't received a lot of feedback yet, so.
And our hope is to be really transparent and honest of, there's a lot of feedback. There's a lot of things we want to do. There's a lot of things we probably cannot do. And we want to be able to tell you at the end of the day, these are the things, thank you for the feedback. These are the things we're going to be able to do. These are maybe years 2, 5, 10. And these are the things that we probably are not or will not be allowed to do. So we want everybody to know that, you know, your feedback just doesn't go into a black box, that we actually take it, process it, and we'll want to do something about it. So that's our hope as part of our commitment to be as transparent and accountable to everybody, because, you know, this is a partnership and we appreciate that, and we want to make sure that your time is not wasted.
And I will say, when we held our equity tabletop discussion, that that was some feedback that we did hear pretty loudly, not about the marketplace specifically, but about OHA more broadly and ODHS more broadly, is that they're really good at taking feedback, but not necessarily good at like reporting back on the outcomes of that feedback or what the results were. And so it was already kind of top of mind for us, but it just reinforced the importance of making sure that that is really visible. So
we don't have it. We don't have a deliverable yet. We don't have a product. It's definitely a concept that's right in front of our brains. So we will definitely share that with you all at some point to say, hey, this is format work. We want to make this as a living document, and we'll keep going at it until, of course, we launch, and we are fantastic until year 10, right? So
next slide, please. And then partnerships are, you know, really paramount for us. We really, you know, we have a foundation of really strong partnerships with, you know, insurance agents, brokers, carriers, organizations that provide application assistance, and also organizations that don't provide application assistance. So we do have a really good foundation to build on, but we really want to leverage those partnerships as much as we can throughout this project. I've already kind of talked about how we're wanting to gather feedback throughout the process and all of this. And so part of that is because we really know that as you, Stacy and Gladys both mentioned earlier, you know, these folks are really experts in the communities that they serve. And we know that, and we trust and really value their input because, you know, for that reason and many others. And so we're working really, really hard to engage with, you know, partners that seem logical, like insurance agents, carriers, you know, assisters, but also the partnerships that don't seem as like logical upfront, like the CBOs that don't provide assistance. So really want to make sure that you guys know that, you know, we're looking at feedback from all angles, and consumers aren't listed on here, but obviously the feedback from our consumers is also very important. Next slide. So I have another discussion page. I told you guys lots of discussions, right? So first thing we want to know is, do you think that you're getting a good amount of project communication? Do you think we should do more or less? Do you think we have enough opportunities for engagement for partners? You know,
that's my first question. Are you subscribed to the Gov delivery on our SBM website?
I think I subscribed them all.
Okay, good.
When we launched.
So you are subscribed. Never mind the question.
For me, yeah. And again, it's not about me, but a little summary, because it seems like there's a lot of information and it's difficult to kind of weed through sometimes to figure out what you really need to pay attention to. So having a quick little like,
kind of like an executive summary.
Yeah, kind of like your little elevator speech for the summer, you know, whatever, and like learn more, click here or whatever. But it's just something a little bit easier to digest, easier, quick to read, and then to walk away with the key points. Right now, I'm getting a little lost in some of the length of the communications, but
okay.
But they're there. I mean, it's really great. I mean, I can get there. It just takes a lot of walk out time to read it.
And when you say executive summary, are you talking about, are you envisioning it in a website? Are you talking about the Gov delivery, like, or a separate email to committee members? What are you envisioning?
Okay. I kind of thinking like just wherever you're placing it, just like these are the 5 things you need to know, right? Just super simple, very elevated, so that it's not everything, but you can easily navigate to where you want to dive deeper. It just seems like sometimes it's just this big list of things to read.
That's good. Yeah.
I think 3 people wrote that down, so we'll figure, we'll
Yeah,
make it happen.
Yes, I love data, but I want to see high level, what's most important.
It's more like, I'm trying to figure out like, okay, I need to like find time to go deeper, like on Saturday or whatever, or can I just get it and feel educated so I can speak to it if I needed to, but
that makes sense. Anybody else? No?
Yeah, my last one. Yeah. I really enjoy the survey feedback, like this is what you've got, this is what you're doing with it. I think, and I know you said you don't have that close the loop yet, but it is important because when you feel heard, right? You don't have to agree with my comment or do anything with my comment, but at least it allows me to continue commenting, right? Because I feel heard. But it's like really, it's so nice when you do things that are influencing other projects or timelines or whatever, you highlight that. We heard this from the stakeholder group or from our community partners. I just think it, again, re-emphasizes the importance of that feedback and that you're doing something with it. So your little pin every time, you know, in your presentations or in your talking points or even your communications out. We heard from you and this is what we're doing.
We heard from you.
We did. I heard from you. I wrote it down. You'll see the change in 3 months. Well, the next part of my discussion is probably the most exciting for me. So I'm just, you know, forewarning that, but branding and identity. Chicky?
I just want to make sure.
Yes, sorry.
Does everybody feel good about the last feedback process? It's, again, to reiterate, this is our current plan. Can it change? Absolutely, based on your feedback. If something is not working, you don't have to wait for HIMAC meetings. Our virtual door is always open. You all have my number, my number, my email, or however you want to reach me by pigeon, that's fine too. But please know that you're not just limited to these opportunities. If you think of something at 11:30 at night and say, Gladys will, I'm sure Gladys will message me, hey, Chicky, think about this. Please do so. Okay, now we can go.
Okay. So this is a very bright and colorful slide, but I love it. So this is our current brand for OregonHealthcare.gov. I put some examples here of some ads that we've ran recently, just to kind of show you our current kind of layout and scheme. And our website actually looks a little bit different now because I just made some updates to it, but it looks very similar to this. So, and this is our color palette, and we do have 2 different logos currently. So we use the Spanish logo on all of our Spanish materials as well. And so the question is for you all, should the new SBM platform have its own identity? In other words, you know, right now we're really leveraging OregonHealthcare.gov. Should we have a whole new identity for the actual marketplace platform? And also just want to hear from you a little bit about if there have been any feelings invoked, whether from you or over the years from your communities that you serve, about the current brands that we have. No feelings?
I've heard nothing, and I'm not a marketing person, so I don't feel one way or another. It's kind of sure, whichever direction, it's fine.
This is where I feel like we might rain on your parade. It's your.
No, I want to hear your honest feedback. Yeah,
pretty colors.
I think whatever reduces confusion is a great goal, and I have not gotten feedback about existing branding other than people enjoying some of the more recent advertising, and I think we talked about that in a prior meeting.
This is Nishoba. I'd have to say, as for the first one, and identity, however you can carry that over and have that one identity between, you know what I mean? I completely agree. The least confusing and separate brand identities can be really challenging, and switching that completely, you know, might interrupt some familiarity that people have. I don't know what the, you know, level of engagement is currently, but have a singular focus would be my feelings and existing brand. I've heard, I've heard some feedback and have experienced some that there's some hesitancy, like identifying ourselves with like a government like entity and like that kind of trust, you know what I mean? However, we can, I think, represent ourselves a little more casually in that sense, non-politically, however that might seem. There's some just, hesitancy in certain communities, like engaging on a platform. They see like, oh, this is a government platform, right? Not just a place where I'm shopping for a plan, you know what I mean? And there's some hesitancy just going to the website, when we see our state brand on there as well.
I think, this is Gladys. I think the only thing that I would think of is making sure that people know if they're applying for Oregon Health Plan or if they're going to Marketplace. Because we don't want them going through the whole process of going through the one, I'm just gonna use the one system, and then going, well, what happened? I got denied. What happened? Not realizing that they applied for OHP versus going and applying through the Marketplace to get a plan because their income is too high or whatever it is. So I think just making sure that it's different enough to where it's well known that this is what it is. It's not what it is and what it isn't. I think that would be the only thing that would be important. Colors are great. Do we want it bright and cheery? Sure, why not? I mean, Health Sherpa is pretty, bland and the information's there. That's what I care about. So that's what's important to me, data. The prettiness doesn't matter. But just making sure they're going to the right place. I think that's the differentiator, no matter what's done, that we don't confuse people, that it's clear.
This is Ron, that's a good point. This is gonna be two platforms, not one. Why not one? And then why not, if you start, and the third question is your income, it could say you might qualify for OHP as an example, and then just direct you to that, because there's different questions on the applications, I get that. But if there's a way early on to differentiate, I don't know. And then second part on that is if somebody's so used to healthcare.gov like me, if you go out there and put your information, well, it's probably not going to let you if you put your state as Oregon. It's going to say, it's going to direct you to the other account.
So for me, in terms of this branding and identity, our OregonHealthcare.gov is kind of like our one-stop shop for every type of coverage for Oregonians. We have, if you go to our OregonHealthcare.gov, you can click on to go to.
Yep. Dawn, we go to the next slide.
Oh, look at me. Totally thinking ahead. It goes to these other locations, right? So that's kind of the tool for it. It kind of evolved throughout the years. It became, not a one-stop shop, but like no wrong door. Like if you go to this website, you can hit all of these potential options for you. So between that, so like that's itself, it's utility, that's what its identity is for. And then we introduced this new tool, and we're not healthcare.gov. So I'm like, is it too close to healthcare.gov, right? If we have our own state version. So that's kind of like, I'm trying to think about what can we do to stand out a little bit so that it's not as confusing. What can we do to maybe attract health insurance? Is not the sexiest product out there. I'm not trying to be sexy or anything like that, but just like, what can we do to attract more consumers while also informing them, hey, there's a large change coming. Come over here because you're going to need health insurance, and we have this new tool for you. So trying to find that balance of being attractive for folks to come, and also separating ourselves a little bit from healthcare.gov, but also not forgetting that this is what folks have been used to for the last 10 years, is this no wrong door OregonHealthcare.gov. So just kind of planting seeds, kind of to help the thinking process a little bit more. If something pops in your head, would love to hear about it for sure.
This is Charlie. I mean, continuity to me seems like the right approach. Like coming up with something new as opposed to going with what people think of and have thought of for the last 10 years seems like, all else being equal, the right thing to do. And I don't know, I wouldn't necessarily be worried about people being confused about healthcare.gov versus Oregon. I mean, you know, because we're in Oregon, it makes sense that it'd be Oregon healthcare. If I'm thinking about like search terms, Oregon healthcare on Google is probably what people would search for when they're looking for health insurance, and that is what it's called. So
it'd be weird if you didn't have Oregon in the name. I think that's what would be confusing.
Yeah.
To your point, like, yeah. So.
Well, unless you're looking at doing something like there's Cover California and Washington Health Finder, what we had Cover Oregon, you know, are you looking for something
We're
like
not
that?
looking at doing something similar to that. Just for the record.
If I could add an example, I think what we are getting at is a lot what Michelle was talking about, which is something catchy, easy to remember. And when we say we're not looking to do something like Cover Oregon, I think it's just not using those words.
Yes, right.
But in that sort of spirit of Pennsylvania is a great example. They came up with Penny. That's what they named their exchange. So that's when people go to Penny, they're going to sign up for health insurance, and they kind of made that branding association.
Can I just say how creative that is? Because it's PENNIE, so it's Penn Insurance Exchange. I'm like, it is very like.
Isn't that? I'm trying.
we thought it's like Ori, no.
Ori.
And then
Well, first of all, I feel so disappointed. I cannot be there because I have an appointment after this. But you seems like you guys having so much fun. That's great. Oh, next time then. But looking into this slide though, I like it. But could it be possible to add like a pre-screen? You know, for people, simple to say, hey, just age, income, family member, and then you are qualified for RSP, and then you go to Marketplace. Instead, you know, on the website that I'm looking, OregonHealthcare.gov right now, but there is no pre-screen. You have to go into the window shopping to do that. If you have a button that someone can pre-screen their income and they can know direction where to go, that would be nice.
Thank you. Can I ask a question?
Yeah.
Hi, everybody. Katie Button. Sorry, I had to step out and I've come back in, but I was wondering, since we have folks who work with consumers, are a lot of your households split income between OHP, like kids on chip, and people on Marketplace, or are you mostly working with people who are going like everybody's going to OHP or everybody's going to Marketplace?
It's a split for the most part. I have a lot of splits. I do have some that they're all on Marketplace, but probably half my families that have kids, if not more, are on chip versus.
Yeah. Likewise.
Thank you. I'm just thinking about like what you're saying about like, could we do some sort of pre-screening and thinking about what that would mean for split households? So thank you for indulging me.
If I can just finish out the brand identity topic really quick. So the two identities, I was wondering if it makes sense. Your first identity is really that continuity of like, it's simple, it's clear, it's going to help you get where you need to get to. And then your little pizzazz is maybe the identity on your Marketplace, maybe. I mean, if you do it, but it is hard. I think everybody's talked about having multiple identities, but it could work for you in this situation.
And this is Paul. I like the concept of the snazzier name because you do risk some of the confusion for the people already in the system. But it's like our next best chance to finally rope in some of the others and if it takes a fun mascot type thing, like whatever it takes, like
we're putting Victor in the mascot costume.
Yes. We also know we have to be very careful with catchy, because that's come back to bite us before. So it's lots of extra things we have to think about that a lot of other states didn't. So
I will say that one of the things that I've been working closely with the OHP communications side as well is how can we get people kind of like the Keep Covered campaign, like how can we make that call to action to go to OregonHealthcare.gov so that they can use the window shopping tool and get to the right place the right time. And so I'm hoping that we can like continue that path forward so that people are going to the website, they're finding help, or they're figuring out where they need to go to apply. So I very much value all of the feedback. And then I have one more slide. I have a couple more slides, but one more slide related to this. So we've already kind of started talking with our marketing firm regarding this particular topic to see what sorts of research and development would go into creating a new brand identity for the marketplace. And so what we're looking at is obviously, you know, we're going to be pretty focused on OE here pretty soon, so not overlapping with that. But as soon as open enrollment gets done, we're going to start you know, multiple month research project, so to speak, to really dive into, you know, we don't know what it looks like exactly yet because it's not planned out yet, but you know, maybe that will be focus groups with consumers or with assisters or agents or carriers, you know, bringing it to the listening sessions to talk, things like that, to really dive a little bit deeper into some of the discussions that we've had today. And also to just see what some maybe like really rough preliminary concepts, how they resonate with people, to see like what direction we might want to go. So that will help inform the decision, and then we would start kind of working on some of the deliverables next year. So that way we can focus again on OE for 2026. I can't even believe that that's like in my, yeah, anyway. Sorry, my son graduates in 2026, so I'm just like, oh. And then 2026 would be focused on brand launch, and we would do really a staggered phased launch approach. So we would start with internal and state staff, then we would move to partners, and then we would move to consumers. So that way, it's kind of trickling down, everybody feels comfortable here, we start disseminating it further. Feel comfortable here, start going a little bit further. So that's kind of the thought process, so that we can launch the brand, you know, somewhere around October 1st of 2026. And then that way people know where to go ahead of open enrollment. So that's kind of the thought process. But again, I just want to really reinforce that that research component that we're planning to do at the beginning of next year will really help us inform the direction we take and what we decide to do. And then I just have like 2 more slides. They're kind of boring, but one of them is just, you know, opening the door. If you guys have any other feedback that you want to raise.
It's pretty.
I mean, it's a pretty slide.
That was one of the new things we added, and we added, no, I was gonna say we added it before the Barbie movie, no.
No?
Roughly around the same time. So we were.
I never thought about that.
Whole different kind of
leverage that. Yeah. Like, and then the next slide is just a reminder of all of our ways to stay up to date for the project. And like, you know, Chicky mentioned, our doors are always open, so you're always welcome to contact us. We also, if you go to the project website, there is a link there where you can submit feedback or questions or whatever if you want as well. I think that's it for me. I've talked a lot. Oh no, I'm just kidding. Just kidding. I got your guys' hopes up. We do have a listening sessions next week. So I'm very excited for those. We're going to be kind of having a similar discussion as what we did today. So that's kind of the topic of the month. But if you want to join, you can feel free to register, and we'll continue to have these through January 2027 is the current plan. Okay, I think I'm really done now, so.
But wait, buy now, get 2 for the price of 1.
Thank you. So I think we have another public comment installment, and then we have a few things to wrap up the meeting after that. Is anyone signed up at this point for this installment? No. Okay, are there, if there's someone listening who wants to speak, please just come off mute and introduce yourself, or you can raise a hand or put a note in the chat as well. I'm letting the silence work for me.
Okay, I think that's enough time for
That
someone
was
to come off
actually
mute.
going through my head.
Okay. I think with a couple of remaining topics, one around sort of just the regular, and I'm sorry, I'm not looking at the agenda right now. We've got it up. Looking for some requests around topics for the October meeting. I know we've sort of the ongoing interest in the mitigation conversation, ongoing state-based marketplace items, other things for the committee.
So this is Paul. On the mitigation front, it did occur to me after the others left. Thanks for coming back, Katie. But this is more of a DFR thing. Like the need for mitigation will have moved from theoretical to measurable. And it might be nice to see whether it is the DFR actuaries or someone to just show, you know, a couple different incomes, a couple different areas, standard silver, standard bronze.
Where we've landed, yeah.
What's actually going to be the change for customers? Because my thought here has always been we would love mitigation to ease the impact on the marketplace members. But lacking that, at least, how do we communicate? How do we, you know, my biggest fear is that someone goes in, sees that they now have a premium or sees that their premium is now much bigger and just walks away versus no, there's going to be options. There's hopefully some other options and just getting them ready for a different view than they may have had in prior renewals. And I think a good start would just be, can we see some examples of the bigger impact and out-of-pocket premium that people may feel?
So I can definitely do some examples. Would you like me to use 2025 rates since they will be final by the October meeting?
Yeah, so it'd be like, here's the real impact, here's the new second cheapest silver that's gonna help define the subsidy level and yeah.
With some talking points that help us with where folks need to go for more questions about that too. Okay, that's any other, thank you. Any other topics that folks want to add?
I feel like the marketplace is just gonna be a standing
Yeah, I agree.
piece, but I am
Second
looking
thing.
forward to the RFP, you know,
The outcome from
evaluation.
August.
Yeah, like
Yeah.
a little bit like, what were your top three? Why'd you choose the one? And then, yeah, I mean, that would just, a deeper dive into that would be great.
And by the way, open enrollment's around the corner from October, so we will be talking about open enrollment as well. And we'll probably give you an overview, an update, maybe potentially also ask for feedback for some of our any new outreach and education and marketing strategies. We'll give you kind of an update of how our training's been going. That's already started if you haven't started that yet. That's already ongoing. Our standard October open enrollment updates are also on the agenda.
Plus, if you've picked a mascot by then. Let's see, I think there may be some follow-up around a survey if you're interested in an additional planned in person, because we also want to make sure we can get folks' perspective who weren't able to be here. Chicky, anything else you would say about that?
No, not in terms of the meeting logistics, but I do have other wrap-up items.
Okay, I think unless folks have anything else, I think we'll just hand it back to you to close this out.
Okay. So in case you were not tracking, we currently have 4 vacancies on the Health Insurance Marketplace Advisory Committee. The next round of Senate confirmations is September. We are working with the governor's office to at least maybe fill in 2 of those, but we need additional candidates who may be interested in serving the committee. So if you know of anybody, specifically marketplace enrollees, those are always they're always hard to find members for. And that tribal representative. So if you know of anybody, we'd be happy to talk to them. If you want to talk us up, that would be fantastic too. If you would like to endorse us, we'll always take a Google review. We will always take an endorsement, but please do send them our way if you have any recommendations, and we'll be happy to help them through the process. And then of course we have a few months ago, I think after our April meeting, I sent out an email saying, hey, we're looking for nominations for our chair and vice chair. We do have 2 nominations and our nominees have accepted. Those nominations, we have Lindsay was nominated as chair and then Neshoba as vice chair. I will be sending out possibly by this weekend a brief bio and additional information for the committee, and then we will hold elections in October. So if you want to get to know them, I'm sure you're more than welcome to hit them up. Their doors are open. I'm calling it out. Their doors, I'm sure, are pretty open. They can answer any questions that you may have. So thank you for the nominations and thank you for accepting. That's the biggest thing. Thank you for accepting the nomination. So looking forward to the elections in October, which is our next meeting is October 17th. And that's it for me.
I don't think there are other slides, right?
No.
That's it. I think we are then adjourned, would be my sense.
And on time and early.
I didn't even look, but I believe you, and that is impressive.
Thank you, everybody, for joining us today online, and thank you, everybody, especially for those who had to drive a long way to come here. We're glad you were able to make it. Thank you. The meeting is adjourned. Thanks to you all.